Welcome back to the Noon Show on WBAY TV2, and welcome to Ask the Expert. With Dr. Kurt today of Tower Clock Eye Center, who has been serving this community, not necessarily personally, Dr. Kurt,
Right.
but Tower Clock Eye Center for over 3 decades.
Right.
And in that time, you have seen technology change, I'm sure, incredibly.
Correct. Yeah, absolutely. And that's one of the fun things about being an ophthalmologist is that, things are constantly evolving. What we're able to do for patients, the options available to patients, is really an ever-changing environment. So every year, every 2 years, something new comes along that really revolutionizes what we're able to do.
When you look at the eye, it's always unique, and you're dealing with unique issues, sometimes multiple issues in a single eye, nearsightedness, farsightedness, astigmatism, all these things that come together in a perfect storm.
Exactly.
But there are some now lens implants that have been developed and have come along that are making your job probably a lot easier and vision for your patients a lot better.
Exactly. So, newer lens implant options. There have been now for about 10 years what are called multifocal lens implants that allow us to correct not only distance vision for a patient, but reading vision also, so that both eyes would see well at distance, both eyes would see well up close. And patients have been enjoying that benefit for, like I said, the better part of a decade now. What's newer is the ability to take that type of lens implant and also correct astigmatism. So there are now what are called toric lens implants, and anyone who's a contact lens wearer who has astigmatism has heard that term. They've used toric contact lenses to correct their vision. This is using kind of that same concept mixed into a multifocal lens so that we can very accurately correct not only astigmatism but the distance and near vision also.
So what does this exactly mean for the patient? Who would they otherwise have had to come in and sort of pick one or the other, whatever was best for them, and deal with the other?
Yep, absolutely. So what it means for the patient is we can give them sharper vision, and it means that they have more options. So it used to be that if someone walked in and they wanted a multifocal lens, if that patient had a moderate amount of astigmatism, we could work around that using other methods of correcting their astigmatism and give them a very good result. Now we can just accurately correct the astigmatism at the source and really enhance the results we can give to that patient, but it also expands the patient population to people who otherwise previously had too much astigmatism to work well with a multifocal lens. So it's really broadened the options available to patients, and it's allowed just about everyone to have access to multifocal technology.
Tower Clock Eye Center, serving this community for over 30 years. Dr. Kurt, thanks for being here today.
Thank you.
If you need to get a hold of anyone at Tower Clock Eye Center, it's as easy as following the information right on your screen. It's always available by going to WBAY.com and clicking on Ask the Expert. We'll get you back into the Noon Show here on WBAY TV2 right after this.